Welcome, everyone. Thank you for joining us today. I'm Theresa Marentette, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Due to the scope of the current testing, we will no longer be providing the total people tested or the number of tests pending. Random testing will continue today at the Essex Center Sports Complex on Fairview Avenue until 5 p.m. Any resident of Windsor-Essex 12 years of age or over can be tested. People will need to provide a health card number, first and last name, date of birth, and their address. Please check the Ministry of Health's online portal or the link on our website to access your results. I will now share the most current case counts. There are 91,705 confirmed cases of COVID-19 in Canada, and 28,263 cases are in Ontario. Chatham-Kent has 146 cases, and Sarnia-Lambton has reported 263 cases. Michigan now has 57,532 cases, with 11,058 cases being in Detroit. Today, we are reporting 977 cases of COVID-19 in our community, an increase of 7 cases from yesterday. 497 cases have resolved. 20 people are in the hospital. 18% of our cases are between the ages of 20 and 29, 18% are between the ages of 30 and 39, and 16% of our cases are 80 years and older. 49% are male and 50% are female, with 1% unknown at this time. Our community has now lost a total of 66 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. Our health unit is currently working with 2 long-term care and retirement homes that are experiencing a COVID-19 outbreak. Testing is available for symptomatic people, those who have at least one symptom of COVID-19, even mild symptoms, and testing is also available for asymptomatic people based on their level of risk, including people who are concerned that they've been exposed to COVID-19, people who are contacts of a confirmed case, or who may have been exposed to a confirmed case or a suspected case of COVID-19, and people who are at risk of COVID-19 through their employment, including essential workers such as healthcare workers, grocery store employees, and people working in food processing plants. No one who is symptomatic or is concerned that they've been exposed to COVID-19 will be declined a test at an assessment center. Common symptoms of COVID-19 include fever, a new or worsening cough, and shortness of breath. However, other symptoms may be present, such as a sore throat, difficulty swallowing, unexplained fatigue, an increase in falls, nausea, vomiting, chills, and headaches. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit ehealthwindsoressex.ca. Windsor-Essex has 2 COVID assessment centers, Erie Shores Healthcare in Leamington, and Windsor Regional Hospital Alet Campus. SOHAC, the Southwest Ontario Aboriginal Health Access Centre in Windsor, also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. I regret to share the news of another death in our community related to COVID-19. A female in her 70s, a resident of a long-term care home with comorbidities, passed away yesterday. My thoughts and prayers are with the family in this difficult time. In partnership with local municipalities, the Windsor-Essex County Health Unit has launched our annual West Nile virus surveillance program. This program includes larviciding catch basins, standing water sites, and lagoons to disrupt mosquito breeding, educating residents on self-protection, conducting adult mosquito surveillance, and investigating positive human cases of West Nile virus in the community. The Windsor-Essex County Health Unit has been conducting West Nile virus surveillance program since 2003. This involves setting up traps at various locations, 26 throughout Windsor and Essex, to capture mosquitoes for identification and testing to determine the presence of West Nile virus and Eastern equine encephalitis virus in the area. The mosquitoes caught are sent to a certified lab for identification and viral testing. In 2016, multiple tropical species of mosquitoes, Aedes albopictus and Aedes aegypti, were identified during routine West Nile virus surveillance and in the city of Windsor. Both of these mosquitoes, not normally seen in Canada, can carry viruses such as Zika, dengue fever, and chikungunya. The health unit responded by developing an enhanced mosquito surveillance program. As part of this program, species-specific traps are set up at 21 locations throughout Windsor and Essex County. These traps use a scent lure and dry ice to attract daytime mosquitoes. In 2019, this program was further expanded into the county, where Aedes albopictus mosquitoes was discovered in Kingsville, Ontario, at the end of the season. This year, we will be deploying additional traps in Leamington and Lakeshore to monitor the spread of these mosquitoes. In 2019, 979 mosquito pools were tested. Out of these, 27 pools were positive for West Nile virus, and we had one human case of West Nile virus in Windsor and Essex. There is no evidence that mosquitoes can transmit COVID-19. Although mosquitoes cannot spread coronavirus, they are known vectors of several other potentially serious illnesses such as West Nile virus, Eastern equine encephalitis, Zika virus, malaria, etc. There are no vaccines for many of these diseases that mosquitoes can spread, so it is important to protect yourself. Some tips to protect yourself and your family from mosquito bites include removing any standing water in places such as bird baths, buckets, old tires, pet water dishes, gutters around your property. Mosquitoes can breed in containers as small as a bottle cap. Wear long-sleeved shirts, long pants, and a hat when outdoors. Light-colored clothing is best as mosquitoes tend to be attracted to dark colors. Use insect repellents that contains DEET, icaridin, or other approved ingredients on clothing as well as exposed skin. Always read and follow label direction. Make sure that door and window screens fit securely and are free of holes. Call 311 or your local bylaw enforcement for standing water observed in your community. For more information on mosquito safety, please visit the Health Unit's website for most up-to-date information and information on mosquito surveillance program and diseases in the community. Thank you.
We'll now take questions from the media. We'll start with AM 800.
The 7 new cases, is there a breakdown on that?
One is a farm worker. The rest are all community cases.
Okay, and explain to me again why you are not releasing the number of tests and pending test results.
So there has been a new testing strategy launched by the ministry with many different partners working and doing these testing in different settings, which is not directly reported to public health. So our numbers, if we continue to report the way we are, it will not be accurate number with respect to the number of tests that are happening and the number of results that we are getting back. Most of the information that we were providing previously were from the testing that was done at the assessment center or some of our key partners such as primary care providers and other partners, and they were providing us with all the information. Now that the testing has been expanded broadly with many partners testing, our numbers will not be accurate, so we do not want to misrepresent any information that will give any false information. So that's why we will report mainly on the positives and some of the work that has been doing, and we'll continue to do that.
Okay, thank you.
Any questions from Windsor?
Just a question about the total tests. On the website, it still shows the total test as 17,000, but yesterday we were at 18,000. Is that going to be removed from the website, or which number is correct for yesterday?
I would say 18,000 would be the correct number, but just because all these numbers are changing and now there are multiple testing happening, even with drive-through testing, we tested 1,700 tests. And other partners, they are doing the testing, and hospitals are doing their own testing for their staff. So there are a number of activities that are happening, and we may not necessarily capture all that number. There is no way for us to get that information. So I would say that as of yesterday, whatever the number was, we will not be updating that just because of the same reason that it won't be accurate.
Okay, thank you.
Any questions from the Windsor Star?
Who are some of these partners executing their own tests now?
So hospitals obviously are doing their own staff testing. Many of the other community partners, as per direction of the ministry, if they are able to do their own testing, they are doing their own testing. And as we know that the ministry also launched their new testing policy and strategy, which would involve more broader testing, targeted testing at various sectors that will be initiated and led by the ministry, working with many other partners. And public health core work is now moving more towards the case and contact management that we are doing. So I don't have the complete list, but mainly it's the hospital and the employers themselves who are engaged in these type of testing as per ministry directions.
Do you have any updated information about the migrant worker death reported? Do you know today if he spent any days in a hospital after being brought there?
So we, as part of our case and contact management, public health staff were in contact with this farm worker every day. It was unfortunate and it's very tragic to see the outcome of that for that individual. But the person was doing fine, was resolved with all their symptoms, and died suddenly. And that led me to even reach out to the chief coroner's office to request an autopsy or to learn more about what caused that, because people in their 30s, they just don't die suddenly. We know that there are some evidence in terms of the clotting disorder that could happen after COVID-19, and if this could be one of the contributing cause to for this individual. So we want to know from that perspective, so we can try and anticipate what we can learn from it. And obviously it's shocking, it's tragic, and we want to know what led to this, because from a public health case and contact management perspective, this individual was doing fine, was not having any symptoms, and it also led us to work with our partners with the hospital and the EMS to go and do more in-person assessment of these individuals who are self-isolating. And the thought behind that was because of the various reasons I mentioned yesterday as well, in terms of the language, cultural barrier, and their inability to express some of these issues, whether as a fear of prosecutions or fear of anything, that they may not be forthcoming with all the information. To be there on the ground and to see how we can support them better, so all of those works are happening, and we are looking forward to get some more information after the inquest and see what we can learn in the medical community and also as a public health community to prevent these type of deaths from happening in the future.
So what you said yesterday about him calling for assistance, medical assistance himself, that was accurate? He did make that call?
So just a slight change to that. The call was made by our nurse who reached out to this individual, and on conversation, the person reported shortness of breath and chest pain. That triggered our nurse to call 911 immediately, and the EMS came in and took this person to the hospital.
Thank you.
Any questions from CBC?
Yes, good morning. Yesterday, Ford said he's going to be pushing public health officials to test all migrant workers. So in light of those comments, is that going to change anything in your approach to testing migrant workers here?
So we are testing migrant farm workers, and I think I said this a few times as well, that we are testing all these farm workers as and when it's appropriate, expanding the testing every time we are coming across with these cases. Any and everyone who come in contact with most of these farm workers, they are tested. We have more than 170 farms here and more than 8,000 people. So we definitely need some strategy to, even if we want to test them all, we need some concrete strategy to go ahead and do that, recognizing that there is a strategy that is being unfolded by the ministry to expand testing and include these group for testing as well. So I'm looking forward to get more information to see how this would be unfold. Our focus right now is case and contact management, and we'll continue to do that and expand the testing as needed based on the case and contact management piece. The surveillance testing, which we are talking about all the time, so there's a difference between surveillance testing, diagnostic testing, and for the purpose of case and contact management. And we have different roles in each of these. Our focus is on case and contact management and expanding the testing based on the need of case and contact management. For all these surveillance testing, that is being initiated by the ministry through a different strategy with the goal to test many of these high-risk workplaces or frontline or essential workers. So that is coming soon, and we'll look forward to it.
Is that going to require a push for you to get more testing of whatever? I know there were multiple types of tests that you said that would work in a mass case. Is that still, those I'm assuming are still not available?
So I've always said that in an ideal world, especially when we're talking about these type of essential workplaces or businesses that has the potential for people to come in contact with many other people where physical distancing cannot be maintained, the ideal solution in my mind would be to have a point of care test available for all these people to be tested every day, every morning before they start their work, and then just continue on with that. So that's the ideal solution which we can think of in terms of ensuring that the workplace is safe for that particular day. What does it look like? How it unfolds? I think that is critical. And unfortunately, right now we have limited options for testing all these essential workers. If we get all these range of testing available, that would be best for everyone, and we would know for sure what we are testing for and what answer we are getting. So if we're really concerned about these workplaces and really want to ensure their safety, this is what we think that would be important to ensure that the workplace continues to be a safe environment for everyone.
Okay, thank you.
Any questions from Blackburn?
Yeah, you were talking about how you can't have an accurate number of testing and things like that due to so many different partners now administering the tests. What is that going to do for your data collection in the sense of knowing how many cases are percentage-wise are coming back positive, or even the number, you're keeping track of the number of asymptomatic people with COVID? Will you still be able to track those types of things?
Great question. It would be very difficult for us to provide that level of great detail, and we may not be able to learn from all these asymptomatic testing that would happen with who's coming back, like what proportion of these tests or results are coming back. Obviously, we will be notified for any positive, whether it's a false positive or a true positive. We will be aware, and we will do all the case and contact management. But in terms of putting all these into perspective, that if, let's say, for example, we tested 1,000 people and we have only 2 positive cases and all asymptomatic, what does it mean, and what's the implication of that from a local decision-making perspective? We may not be able to answer that question. We are trying to get some hard numbers to make the best use of whatever testing that is happening, but it will be a challenge. And I like your question. It's one of those concerns that we have, and we hope that we can access that information to help us in our local decision-making.
Next question, how would that affect your decision making or the orders or directions to the community?
Well, we'll have to go back to the case and the spread and the changes, what we notice. And there may be some ways to identify just on the case, not the ones that were tested and were negative, just on the case whether they were symptomatic or asymptomatic. So we will get that information, and when we put things into perspective and do our case and contact management, we would know exactly if the case was had an identifiable risk factor, either through a workplace exposure, either through coming in contact with a confirmed case of COVID, or where they possibly acquired the infection. And if we can put all those things into place, we will know that if maybe a particular workplace, a particular industry, or a particular person who come in contact with another case, how that happened and how we can reach out to all those contacts and how we can break that chain of transmission from happening. If it's a particular workplace, and then if we are able to link that the two people who work in the same place and possibly don't have any other reason to be in contact with each other outside of the workplace, then that means that we maybe have something that transmission is happening at the workplace, and we'll have to look at it. So there's a lot of complicated case and contact management work would continue to happen. It won't stop. The only difference would be that we won't know the asymptomatics who were tested and were negative, and how we would use that information to even paint a picture that the number of people who were actually tested and came back negative. So I think it would be challenging, but we'll use the information that's available, and we'll share all that information and the thought behind how we are using that information with everyone.
Any questions from CTV?
Just a quick number, how many migrant workers have been affected by COVID total?
So far, as of yesterday, I believe it was 175, so we'll add one today, so that will become 176.
Any further questions from AMA 100?
No, I'm good, thank you.
Windsor?
No, thank you.
Windsor Star?
No, thank you.
CBC?
No, thanks.
Blackburn?
No, thank you.
CTV?
Radio Canada.
Radio Canada?
Yeah, I'd like to know how many migrant workers are infected right now. Not since the beginning of the pandemic, but right now.
You mean the active cases at this moment?
At this moment, yeah.
So I believe between 45 and 50 cases are resolved, and the rest are still active. So that would leave approximately 120 active cases that we are working with right now.
Thank you very much.
Okay.
Thank you very much.
All right. Thank you.